Yeah, absolutely. Everybody always wants to know what the risks are to any surgery, right? And there's a risk of getting your toenails cut or a knee replacement or a cardiac bypass, and certainly a bariatric surgery isn't without its own set of risks. So risk number one is you've got to go to sleep and you've got to wake up, right? So everybody undergoes general anesthesia. One of the things we do to mitigate or decrease the chances of any kind of risk from that is we have everybody go through cardiopulmonary testing in the office. So those patients who don't already see a cardiologist or a pulmonologist for any reason because they're otherwise healthy are going to come in, and we put them through rigorous testing, both resting and with exercise, to make sure their heart stays safe and they don't have any abnormal heartbeats, and that their lungs have good capacity to come off the ventilator after surgery. So that's number one. Now, for those patients who already see a cardiologist or a pulmonologist, that's generally not without a good reason. So we look to those specialists and get a clearance from them before we put the patient for surgery. Anytime you cut the skin and operate inside of somebody's abdomen or anywhere else, there's chances of bleeding, there's chances of infection. So there's chances of things like blood clots. Those would be the main issues that we would see after a bariatric surgery. So a lot of things that we do to try to decrease risks of that are certainly we are slow and deliberate during the surgery. Bleeding doesn't seem to be as big of an issue. That's generally something that's self-limited, takes care of itself. Clotting is the bigger word for us. People for deep vein thrombosis, which can lead to clots in the lungs and things like that. We try to prevent that by giving everybody blood thinner before surgery and then afterwards for about 2 weeks. That really decreases the blood clotting that we see out there. Infection is generally caused by something like a leak. What we mean by a leak is anytime we're operating on the GI tract, those areas have to heal up. We're removing portions of the stomach or making the stomach smaller and moving the small bowel around. Those new connections that we make have to heal. And if they don't heal together appropriately, then you can create a leak and patients can get sick from that. So we test every patient while they're in the hospital, generally while they're in the operating room, to make sure that everything looks good. We watch them very, very closely, and if leaks happen, which they will about 1% of the time, we can be right through on top of it and fix it before they get very sick.